guys. Welcome to Live Science. This is your fourth installment of Mental Health Awareness Month, Wellness Wednesdays. So today we'll be talking about psilocybin, which is magic mushrooms, with depression, as well as some expressive arts therapy. So today with me, I have our reporters, Rachel Retner, Lanice, as well as Caitlin. Welcome, guys.
Hello.
So first up, let's talk with Rachel. Hi, Rachel. How you doing?
Hi, I'm good. So I'm Rachel Retner. I'm a health reporter for Live Science. And today we're talking about promising research on the use of psilocybin for treating mental health conditions. And so psilocybin is perhaps best known as the hallucinogenic compound found in magic mushrooms. And the drug has an interesting history in the field of psychiatry. Research on its potential uses as a treatment actually began in the 1950s, but was halted in the 1970s after psilocybin was classified as a Schedule I drug, making it illegal. But over the past decade, there's been a renaissance of sorts in the study of hallucinogenic drugs for mental health conditions. In recent years, a number of studies have suggested that psilocybin could provide benefits to patients with depression who haven't benefited from other treatments, or to people with cancer-related psychological distress. And most recently, I covered a study published in the New England Journal of Medicine that found that psilocybin may work just as well as a common antidepressant drug at treating symptoms of depression. And the study found that people who took psilocybin twice in a 6-week period under the supervision of psychiatrists showed similar reductions in their depression symptoms compared with people who took a 6-week course of the antidepressant escitalopram. But experts caution that this study and other similar studies on psilocybin have been relatively small, and so more research is needed to confirm the findings. And I recently spoke with Dr. Stephen Ross, the Associate Director of the Center for Psychedelic Medicine at NYU Lagoon Health, and who is currently conducting studies on the use of psilocybin for treating mental health conditions. Thanks so much for being here today.
Yeah, my pleasure. Thanks for having me.
So there's been a number of promising studies in recent years suggesting psilocybin may provide benefits to some people with depression or people with cancer-related psychological distress. And in light of this research, could we see psilocybin approved as a treatment for depression or other mental health conditions sometime in the near future?
Yeah, I think it's moving that way. There's a couple advanced research programs testing psilocybin in major depression that are in phase 2 studies currently and looking to head into phase 3. And if all that goes along, it could be anywhere from like 3 to 5 years for that indication, I would predict. But then there are other efforts as well. I'm leading an effort at NYU to do advanced trials in psilocybin to treat advanced cancer-related psychiatric and existential distress, a follow-up to work that we at Johns Hopkins and UCLA had done. And that's moving forward as well. So that's another potential indication dealing with existential distress at end of life. There is the main target. And then at NYU, we also have an advanced research program using psilocybin-assisted psychotherapy to treat alcohol use disorder that Michael Bogenschutz and I are leading and finishing up a large phase 2 trial. And we hope to roll that into phase 3. So those are the 3 most mature psilocybin programs of research. And I think, one of them will get it over the line in the next couple of years, assuming the larger trials show positive findings similar to the other ones. And that's not, we don't know that until we do the research, but it's looking pretty promising.
Yeah, and what are some of the main questions that you're really looking to answer before psilocybin might be approved for one of these mental health conditions?
Well, the main thing is we have to see if it works or not. The field is infused with a lot of irrational exuberance. There's a kind of history to that. When they initially launched in the 40s and 50s, they sort of like similar to what's going on now, became wonder drugs. People thought they were going to cure everything. And then there was a kind of backlash against them. They escaped from the laboratory, went into the general public, and they have real harms associated with them. So the point of doing the research is to look at the risk-benefit profile of the intervention, which is not just psilocybin by itself, it's in conjunction with psychotherapy. And the idea is, to do larger trials to see if there's a clear benefit and to see what the adverse effects are and what the risks are. And then, ultimately, a clinician using this will have to weigh those. They'll have to, look at the risks, mitigate them. For instance, these are not drugs you want to give to people with psychotic illness, like schizophrenia. So you definitely want to rule that out. They really use, in highly controlled settings, the way we do it at the hospital, where two therapists, a lot of safety parameters. So there's a kind of way to do it that maximizes safety, and that's our methodology.
I see, yeah. And I know that quite a few of the earlier trials have been quite small, and so these larger trials are looking to see whether we can figure out who benefits most from this treatment versus others.
Yeah, in terms of the different phases, phase one in the FDA drug development process is usually like 10, 20 people. It's looking at like safety. Phase two trials are bigger, anywhere from 40 to 100 people, and they're looking at preliminary efficacy. Does it seem to work for your target? And then the phase three trials can be hundreds of people, thousands of people. And there you can definitively see, well, is it an effective, an efficacious drug? And then the FDA weighs whether the data is good enough to, make it available as a medicine. Given that psilocybin is a Schedule I drug of the most restricted category with definition, highest addictive liability, no therapeutic utility, it would have to come out of that category to be prescribed.
That makes sense. And I was also wondering if you could speak about what are some of the potential advantages of psilocybin over conventional treatments?
Well, if it ends up working, one of the big advantages is that you don't have to dose it every day. Unlike a traditional antidepressant where you take it every day, sometimes for years, this is more single dose, 2 doses, sometimes 3 dosing paradigms. So the intervention is limited in terms of the exposure to the pharmacologic compound. And so if it works well, it's going to have less side effects over time because, take the SSRIs, they have a big side effect profile. Upwards of 50% of people have sexual side effects. They sometimes can increase suicidality. So a drug that you only take a couple times is what makes this different.
And some of the earlier research is indicating that some of the beneficial effects could be quite long lasting. Yeah, and finally, what would be your message to members of the general public who might have depression or know someone with depression and are hearing about this research?
Depression's a horrible illness. We're studying it now. We're involved in these phase 2 programs for psilocybin for depression. And depression is probably the worst neuropsychiatric disorder of all of them in terms of prevalence and effect to the individual and society. It's a really horrible thing to be chronically depressed. So in this study, we're taking seeing really desperate people who are very upset. And part of the problem is they think they're going to get a magic pill, 1 dose that'll cure the depression. And that's probably not how it works. So, we're continuing to do the trials with depression, and then ultimately we'll see where psilocybin lands. There was a recent study published in the New England Journal of Medicine that compared 2 doses of psilocybin to a typical antidepressant, Lexapro, and it was kind of like a tie. They both did as well, which kind of gave people some pause and sort of, a little bit of the rational exuberance that it would work for everything. It's good that it works as well as the typical antidepressants. And if you only have to give it a couple times, then you have, a drug that's an improved thing from a side effect perspective. So we'll have to see. My guess is in the end that psilocybin will work for major depressive disorder. Major depressive disorder is a kind of very chronic, complicated illness. There's treatment-resistant varieties. I think those are going to need more than single dosing. You're going to need a multiple dosing paradigm. But a lot of research still to be done to figure all that out.
I see. And a lot of these studies, I think, important to note that these psilocybin doses are being given, with support of therapists as well. So it's very controlled setting. Very
controlled. Yeah. I mean, our lab is at Bellevue Hospital, probably the best place on the planet to have a medical emergency or any kind of emergency. So it's in a very safe setting. All of the participants get 2 therapists, very skilled therapists, and they spend, usually 6 to 8 hours before the dosing session reviewing let's say they have terminal cancer, we'll review their life in great detail. We'll review the history of cancer and how it's negatively affected them in great detail. We will then prepare them for the dosing session and go over what to do if difficult things happen. We'll go over how we keep them safe. The dosing sessions are interesting. They're 8 hours long, very long, to sit there. And in the beginning, we have them state their intention for the day to really focus them on why they're there. Maybe they're dying or they have alcohol use disorder. Then we give them the pill and they lie down on their back. We give them eye shades and pre-selected music is played. And the idea is to focus internally. The idea there is to kind of, occasion a type of altered state that could potentially be beneficial. And so it's very much not guided. They have their internal experience. If they need help, we sit them up and talk to them and help them. Towards the end of the sessions, we sit them up and start to look at the content that came up and then do integrative psychotherapy, where we start to integrate their experiences and feed it back into their disease state and to see if anything from the experience shifted their orientation towards death, their depression, their relationship to using alcohol. So that's the model. And that was an old model that was developed during the 60s. And so we have a dosing room here at Bellevue, and we've been doing psilocybin research here for the last 16 years.
Oh, I see. Well, yeah, I think that those are all the questions I had. I didn't want to take up any more of your time. Thanks so much again.
My pleasure. Thanks for having me.
Hi, so yeah, as we heard, this is promising research. We might see psilocybin approved for specific mental health conditions in the next few years. But as Dr. Ross mentioned, we still need to be cautious about this because the trials are still underway. So we're still awaiting those results. And I also wanted to reemphasize that researchers have warned that people with depression should not self-medicate with psilocybin. So these studies have been done in controlled settings, and taking psilocybin in an unsupervised setting using an unregulated dose could have negative effects.
Good point, Rachel. Thanks for doing that. I actually had a question myself because psilocybin is also known as magic mushrooms, and so do you need to experience a trip to get the benefits? Is that how this works?
Oh, yeah, it's a good question. So researchers are actually looking into whether people need to have a so-called mystical experience in order to get benefits from psilocybin, but we don't actually know the answer to that question. But if it's not necessary, some people are looking into creating drugs that might have the beneficial effects of psilocybin without having the hallucinogenic symptoms.
Yeah, I think that's important for some people who are definitely not into that. We have a question from Facebook from Lillian, who asks, will this drug be added to the DNA profile for antidepressants that might work for people? What can you say about that?
Well, I'm thinking, I don't know the answer to that, but I know that there is research looking into whether we can find certain markers that are tied to people's responses to treatment, and including DNA markers. But I think we're kind of far from being able to say whether a drug like psilocybin would work based on your DNA. I think we're far from that.
Yeah, baby steps. But I think so far I've heard it's legal in Oregon as a recreational use, correct, or medicinal?
I'm not 100% sure about that. I know they decriminalized.
State. So yeah, so a lot has to be developed, and these studies are a big stepping stone. So that's really cool, and the more options that people have for treating is better. So yeah, thanks Rachel. So up next we have Nicoletta and Caitlin to talk about I'll just take you that, Rachel, to talk about expressive arts therapy. So I will let you guys take it away.
Thanks, Judy. For full clarity, journalistic integrity, I just want to let everyone know that Caitlin and I know each other and have for quite a while now. We initially met in undergrad, where we were both dance majors and we were both psychology majors, actually. I went down the neuroscience route within our psychology degree, and Caitlin went down the counseling route. And Caitlin also got a certification in dance and medicine, which is a program offered at the University of Florida and elsewhere. And then she went on to get her MA in clinical mental counseling with a specialization in dance movement therapy, which is one of the expressive therapies we're going to be talking about today. So to start off really broadly, I just want to introduce the idea of what expressive therapies even are, what we're talking about. When we talk about expressive arts therapy specifically, and Caitlin, if you could enlighten us on that front, that would be great.
Yeah, absolutely. So if to give more of a textbook definition, expressive therapies are using creative practices either as a form of or incorporated into forms of traditional therapy. And it kind of, per expressive therapist, has a different definition. For me personally, I'm more about incorporating it into more traditional forms of therapy. And so just trying to be innovative in the way that I weave a somatic lens and body and movement into how into a regular clinical setting and a regular counseling, what people think of when they think about talk therapy. As far as expressive therapies, that is an umbrella term that you have different modalities. So there's music therapy, art therapy, dance therapy, drama therapy, all sorts of different things. And there's also what they call expressive art therapy, which is more intermodal, and they kind of weave in and out, and it's not necessarily one specialization, but instead they can kind of go in back and forth and in between. And a lot of programs that have the specializations, they also talk about being intermodal. So I primarily look at things through the somatic and that body-based lens and do movement groups and dance therapy groups. But I do art groups, or I'll intertwine things into my dance work as well. So maybe we process things by talking through movement as well as through drawing. And it's really just about being innovative and thinking outside of the box is what I think expressive therapists really bring to the table. It's not just about using their modality and their creative practice, but it's also about really coming at any problem from all angles.
Yeah, I'm wondering, in terms of excuse me, we have some alarms going by clearly.
Chopping a tree outside my house, so it's fine.
Your specific practice, I don't know if you could describe, number one, the kind of populations you personally work with, but also what a typical session might look like for you coming in and thinking in this kind of broader lens than perhaps a typical therapy session that would primarily be talking.
Yeah. So, first of all, I work with two different populations specifically. I am an expressive arts coordinator, and what that means is that I'm just kind of in charge of expressive therapies, primarily the dance therapies, for an assisted living facility who have just traditional care for older adults, as well as a specific memory care unit. And so I work with the aging population, but it could be anything from just a typical age-related cognitive decline all the way through dementia, Alzheimer's, all sorts of different types of cognitive decline. And then my other job is I wear many hats, but I primarily am the person who does an intake with a family for a family bereavement center. And so we work with families who have children between the ages of 3.5 to 18 years old who have experienced either the death of a parent or a sibling. And so I help with groups. I help with, and that kids groups, adults groups, all sorts of things, as well as do consultations and stuff like that. So as far as what expressive therapies look like in both of those settings, I do dance movement therapy groups, with more so with my assisted living facility, and then I bring that lens into doing more art-based and music-based. And somatic lens that I use in both is breath work a lot of the time. So really regulating your nervous system by slowing your body down, by slowing your breath down, by doing something artistic, and just really focusing in on something else and focusing not necessarily on what's going on in your brain, but putting it out into something other than words. And it's not to say that a lot of dialogue doesn't come from that. Quite often more dialogue comes after we've done something expressive, but it's just thinking again outside the box. And I mean, how often do we all have bad days or something anxiety provoking or anything that we can't describe? And I mean, I work with kids, so getting like a noise as a response and to express an emotional state quite often, but also as adults, like sometimes you just have to say that your day is going well, and so just thinking about different ways of expressing that, because sometimes there just aren't words for it.
Yeah, and I think that's a great point. And generally speaking, we think about how, especially when thinking about entering therapy or considering therapy for the first time, there's a lot of, I feel for the general population, there's a barrier where it's like, well, I don't know if I'm even ready to be able to say things out loud or even identify what those feelings are in such concrete terms. And I feel like that's a place where expressive therapies can kind of sneak in and be like, you don't need all of the words. You can begin to process even without that vocabulary, which I think is really interesting personally. And I'm wondering if you could dive into, I know your master's thesis kind of focused on this idea, but if you could talk about, there's both the, just conceptually, that idea of stepping out of your head and like getting out of the stress of trying to put things into words and perhaps finding a new way of expressing what you're feeling. But at the level of the brain, I'm wondering if you could describe how these therapies are actually helping people process things at perhaps a more mechanistic level.
Yeah, totally. So one of the things that I talked about in my thesis was I was doing a lot of work with older adults at that point. So something along the lines of cognitive decline. When you're doing exercise or movement-based things, typically it's more rigorous, but like movement and exercise in general actually increases a production of a chemical in the brain called BDNF, which is brain-derived neurotrophic factor. Whew, it's been a minute since I've thought about that, but it's a chemical in the hippocampus that actually it helps with learning new things and retrieving memories and recall and just remembering things in general. And so exercise increases that production of it. And so that can help with synaptic firing, so making those connections. And it helps with the working memory as well. So thinking about it in that population of older adults where the working memory is more or less decreasing in its ability to function, and that recall ability is getting harder and harder. What that actually is, that recall ability, is those synapses having trouble firing in different parts of the brain, and that your episodic memory can't retrieve things, and that your short-term memory and your working memory can't retrieve things even if they've just heard it. And so the idea that combining movement and putting that to the side and just talking quickly about creative cognition, and that actually incorporates a couple of different networks within the brain. There's the default network, which it's more about like that self-thought and thinking about the spontaneous thought and things that are coming from within your own brain. And then there's a network called executive control network, and it's more about taking those external things in. So like taking those external things that people are telling you, things that are like saying, hi, remember this, or just like prompts that we have for like a regular art project. And it's taking that working memory as part of it. And creative cognition actually combines both of those networks so that you're taking your environment in and then producing something out that is of yourself. And so through dance movement therapy specifically, you're taking that movement that is increasing that chemical in your brain that's helping you remember things, as well as using all sorts of different parts of your brain and really letting those synapses connect and just keeping them practicing firing. It's specific to Alzheimer's, dementia, cognitive decline. It doesn't necessarily stop. That's not what it does. It doesn't stop the progression of Alzheimer's or dementia or anything like that. But the hope would be that it's really elongating that possibility of synapses firing for longer, improving quality of life and stuff like that. And then as far as other things that I do with that somatic lens specifically, which I do with kids, adults all over, is that idea of self-regulation and calming your body down and getting away from that fight or flight part of your nervous system and instead getting into that down regulation where you're really just slowing your breath down, you're slowing your heart rate down, you're slowing your body, and you're regulating your nervous system just by taking deeper breaths in. Those are just a couple of examples about how it gets neuroscience-y.
Yeah, definitely. In that respect, here on the live stream, we've been talking a lot about mental health hygiene, the idea of self-care, and how that can be helpful in maintaining mental health through time. So I was wondering, in terms of expressive arts broadly, if there are certain practices that you could recommend people try at home, especially in terms of that kind of regulating your emotions that you were just talking about.
Yeah, absolutely. I think that finding things for yourself that you like to do, so whether it's listening to music or journaling or doodling, like things that are expressive, things that you probably didn't think about being mental health improvement and improving that, but they really are. So like doodling and getting yourself out of your head is perfect. Singing along and dancing along to a song is perfect. Thinking about outside of the box about how you can shake off some stress, whether it's quite literally or with a dance party, or it's doodling to just not think about your to-do list. I also recommend, one of the things that I always tell my kids and I tell my adults and my teens and whoever I'm working with, and I can offer to all of you, is that when you are thinking about slowing your breath down, that thinking just as much about the exhale as you do about the inhale is really important. So quite often when people are saying, all right, calm down and take that deep breath, people are like, and then they don't let it go. And then you're holding all of that in. And it's like, you think about that inhale, like I've taken that deep breath, but it's just as important to let it out. If anything, it might be more important because that's what letting go of your shoulders being high up from all of this typing, letting go of whatever it is, just letting things escape your body. So whether it's thinking about that exhale, it's thinking about just finding something creative to do. And it doesn't have to be anything groundbreaking. It doesn't have to, you don't have to, people tell me this all the time, like, I'm no artist, I can't do that. Like, I'm not a dancer. And it's like, that's not what I'm asking you to do. That's not what expressive therapists are asking you to do. They're asking you to get out of your comfort zone because they want you to get out of your head. They want you to express yourself in a creative fashion and not think about your to-do list, not judge yourself, not think about, well, anything really other than that present moment. And so that's one of the biggest things that expressive therapies, I think, can offer, is that out of the box thinking way to be in the present moment and to really reflect instead of just, I don't know, being in your head, which I think I am all the time. And I think a lot of people are all the time. So just getting out of it.
Yeah, and I imagine that initial entry into the therapy might be difficult for people because they are coming from a dancer's perspective. That idea of stepping into a space where you're expected to do a certain amount of performing, even though it's not really performing. but it's this different way of engaging your creativity without judgment. And that key phrase being without judgment, that I think is so difficult for people to clue into, including myself. Because especially in the arts, we see this idea of there's a misconception that you're either very talented at what you do, even though people who are very talented in the arts, it's really derived from extensive training, obviously. But there's an idea that there are talented artists, and then there are normal people who don't know how to do anything. But that's not all the case. Number one, you might pick up a new skill, I imagine, through this kind of therapy. You pick up a new thing that you didn't realize you were good at. But it's also, as Caitlin said, it's not about being good at the thing. It's about just exploring a different route of expression, which I think is so cool as a concept. And just being less harsh on yourself in that moment is also a great thing to take away from any therapy. To kind of wrap up here, I was wondering if people are interested in either learning more about expressive therapies or potentially trying to find resources for themselves, either to engage with at home or to find a therapist who has similar training to yours. How would they go about finding those resources?
Yeah, so all of the expressive therapies, again, that's music, art, drama, dance, and expressive art therapists just in general as well. They all have their own organizations. So, for example, the dance therapy one is ADTA, so the American Dance Therapy Association. And there's all sorts of resources. They tend to have like a directory, more or less, where you can look up people in your area, people in your state, and chances are, if you're reaching out to those organizations or you're reaching out to people that they recommend, they also know people even more broadly in the network. So it's an ever expanding field, and we're slowly getting more and more recognition at the expressive therapies in general. But because of that, just reaching out to and looking and exploring those web pages and kind of just going from there, because chances are you're going to get connected with an expressive therapist, specialty, not specialty, who is just eager to expand their network and expand your network. So if they aren't the right match for you, chances are they've got someone from their cohort, someone from their program, someone else that they know through other meetings that would probably be a good match.
Awesome. Well, thanks so much for joining us, Caitlin. I really appreciate it. And if we have any questions, I'm not sure if any came in from online, but we can take those now if people had any.
No, I feel like, Caitlin, you were super thorough with this explanation. Literally, while you were talking, I'm like, oh yeah, sit up straight, shoulders down, breathe. Like, just for myself. And I'm taking care of my grandmother right now. She's in hospice now. So all the things that you said, I'm going to go back to them to talk about literally tomorrow. And be like, can we bring some paint into her place? And I don't know if they have this at the facility she's at. So I might actually be pinging you after this to see how to get that set up there.
Yeah.
Rachel, did you find something out over the other segment?
Oh yeah, just one clarification about what we were talking about earlier about psilocybin use in Oregon, and I just wanted to clarify, psilocybin is legal in Oregon for therapeutic use. In 2020, Oregon was the first state to legalize psilocybin for therapeutic use, in addition to having it be decriminalized.
Yeah. So does that mean in Oregon that they're going to be doing most of the federal studies there? Is that how it works when it's legal in a place, or can they do federal studies anywhere?
I mean, I think you just need to get approval, special approval. So they are doing them, throughout the country.
Very cool. Very cool. All right, guys. Well, that was our show today. I want to thank everybody for joining us. And I think this was it for our Wellness Wednesdays for Mental Health Awareness Month, since May is now over. Hope you guys learned something, and be well out there. Bye.
Bye.